Can this diabetes medication affect your ability to sleep at night? Before we dive in, a quick note. This video is general information only and not personal medical advice. Always speak to your GP, diabetes team, or pharmacist about your individual situation, and never stop, start, or change the dose of any medication without professional guidance. If you're taking Ozempic and finding it harder to sleep, you're not alone in wondering whether there's a connection. The good news is that Ozempic doesn't directly cause insomnia, but some people do experience sleep disturbances whilst on this medication, and understanding why can help you manage them better. Let's start with what Ozempic actually is. It's a GLP-1 receptor agonist licensed in the UK for treating type 2 diabetes. The medication works by mimicking a natural hormone that helps control blood sugar levels. It enhances insulin release, suppresses glucagon, and slows down how quickly your stomach empties. These are all helpful for managing diabetes, but they can sometimes lead to side effects that indirectly affect your sleep. Here's the important bit. Clinical trials, including the large SUSTAIN program that evaluated semaglutide, didn't identify sleep disturbances as a frequent side effect. Insomnia isn't listed in the UK summary of product characteristics either. So Ozempic doesn't have stimulant properties or directly interfere with your sleep mechanisms, but that doesn't mean some people don't experience sleep issues whilst taking it. The sleep disturbances that do occur are typically linked to indirect effects. The most common culprit is gastrointestinal symptoms. Ozempic can cause nausea, reflux, and abdominal discomfort, especially when you first start taking it or when your dose is increased. If you're feeling queasy or uncomfortable at night, that can certainly make it harder to fall asleep or stay asleep. Another factor is how Ozempic slows gastric emptying. This means food stays in your stomach longer. If you eat too close to bedtime, you might experience discomfort or reflux when you lie down, which can disrupt your sleep. There's also the question of blood sugar levels. If you're taking Ozempic alongside other diabetes medications, particularly insulin or sulfonylureas, you have an increased risk of nocturnal hypoglycemia. That's low blood sugar during the night. This can cause you to wake up feeling sweaty, shaky, or confused. Even if you don't fully wake, your sleep quality might be affected. Changes in eating patterns can play a role too. Because Ozempic promotes satiety, you might find yourself eating less or at different times than you used to. These shifts in routine can sometimes affect your sleep-wake cycle, at least initially whilst your body adjusts, so what can you do about it? There are several practical strategies worth discussing with your healthcare provider. Adjusting your meal timing can make a real difference. Try to have your last meal at least 3 hours before bed to give your stomach time to empty. Eating smaller, more frequent meals throughout the day rather than large meals can also help reduce gastrointestinal discomfort. Good sleep hygiene is important for everyone, but especially if you're experiencing sleep disturbances. Keep your bedroom cool, dark, and quiet. Try to maintain a consistent sleep schedule, going to bed and waking up at the same time each day. Avoid screens for at least an hour before bed, and consider relaxation techniques like deep breathing or gentle stretching. If you're concerned about nocturnal hypoglycemia, speak to your doctor or diabetes team about monitoring. They can advise on the best approach for your situation and may need to adjust your other diabetes medications to reduce the risk of low blood sugar overnight. Don't attempt to adjust monitoring or medication schedules on your own. It's also worth keeping a sleep diary. Note when sleep disturbances occur, what you ate, and when, and any other symptoms you're experiencing. This information can be really helpful for your healthcare provider in identifying patterns and determining the best course of action. Now, when should you actually contact your doctor about sleep issues? If sleep disturbances persist beyond 4 to 6 weeks, that's worth a conversation. Your body often needs time to adjust to Ozempic, and many side effects improve after the first few weeks. But if they're not settling down, your healthcare team might consider adjusting your treatment plan. Severe symptoms that significantly impact your daily functioning definitely warrant medical review. If you're so tired during the day that it's affecting your work, relationships, or safety, don't wait to seek help. And if you're experiencing symptoms that might indicate nocturnal hypoglycemia, such as waking up sweaty, confused, or with a rapid heartbeat, contact your healthcare provider promptly. For suspected severe hypoglycemia or acute severe illness, seek urgent medical help. Remember, any side effects you experience can be reported through the MHRA Yellow Card scheme. This helps regulators monitor the safety of medications, and you can find it by searching online for MHRA Yellow Card. Let's recap the key points. Ozempic doesn't directly cause insomnia, but some people experience sleep disturbances due to indirect effects like gastrointestinal symptoms or changes in blood sugar levels. Adjusting meal timing, maintaining good sleep hygiene, and working with your healthcare team can help. And persistent or severe sleep issues should always be discussed with your healthcare professional, who can provide personalized advice based on your individual circumstances. If you found this video helpful, please give it a like and subscribe to Bolt Pharmacy for more evidence-based health information.